Anatomy of the urinary bladder. The urinary system can be divided anatomically into upper and lower urinary tract. The upper urinary tract includes the two kidneys and two ureters, while the lower urinary tract includes the bladder and urethra. Before we start, let's see an overview of this organ. This picture shows a sagittal section of the pelvis. The urinary bladder is a muscular sac that stores and expels the urine. It can carry urine up to 500 milliliters. The site of urinary bladder. It's the most anterior in the pelvic cavity behind the symphysis pubis, as we can see here in this 3D model. But we also should ask ourselves whether it's an adult or child. As in children, it's an abdominal organ. It reaches the pelvis only by the age of puberty. While in adults, the empty bladder occupies the lower anterior part of the pelvic cavity as we have just seen. When it's full with urine, it rises upwards into the abdomen and may reach the level of umbilicus. Let's see the shape of urinary bladder. We will remove the left hip bone and femur to see clearly its shape. The empty bladder has the shape of an upside-down pyramid having 4 triangular surfaces and 4 corners. The superior surface, base or posterior surface, 2 infralateral surfaces, apex, 2 posterolateral angles, and the neck. Relations of urinary bladder. The superior surface in male is related to coils of ileum and sigmoid colon, while in females, the superior surface is covered by peritoneum, except its posterior part. It's related to the uterus, which is separated from it by the uterovesical pouch. The highlighted part is the uterovesical pouch. In males, the posterior surface is related to the rectum, while the lower part is separated from the rectum by both seminal vesicle and ampulla of vas deferens. In females, it's related directly to the vagina. Inferolateral surfaces. They are related to levator ani muscle and obturator internus muscle. Moving to the angles of urinary bladder. The most anterior part is called the apex. It lies behind the symphysis pubis. The apex is attached to a ligament called the median umbilicus ligament. The posterior superior angles receive the openings of both ureters. The last angle is the neck. It's directed downwards and gives the urethra. In male, the urethra is surrounded by the prostate. Let's see how the urinary bladder looks like from inside. In this picture, we have removed the anterior part of bladder to see its posterior wall from inside. We will find a triangular area called trigone. This trigone is bounded by 2 ureteric orifices, which form the superior angles of the trigone, and internal urethral orifice at the apex of trigone. The trigone is more vascular and sensitive than the rest of bladder. The mucosa of trigone is firmly attached to underlying muscle layer, so it appears smooth. Ligaments of the urinary bladder. The median umbilical ligament is a single ligament extending between apex of bladder to the umbilicus. Here it is the median umbilical ligament. It's the remnant of urachus. We will know later what is the urachus when we will discuss its embryology. Medial umbilical ligament. There are 2 ligaments extending between the superior surface of the bladder to the umbilicus. They are the obliterated umbilical arteries that we have taken before in embryology of fetus circulation. Puboprostatic ligaments. There are 2 bands extending from the back of symphysis pubis to fibrous capsule of prostate. In females, there is no prostate, so they are called the pubo-vesical ligaments. It's a blood supply, innervation, and lymphatics. Arterial supply of the urinary bladder. We know from the cardiovascular system that this artery is the common iliac artery. This artery divides into external iliac artery going downwards to supply the lower limb, and two internal iliac artery going to supply the viscera of the pelvis. The internal iliac artery divides into anterior and posterior divisions. The anterior division will supply the urinary bladder, rectum, and so on. That's why the urinary bladder in males is supplied by superior and inferior vesical arteries, which come from the internal iliac artery, particularly its anterior division. While in females, instead of the inferior vesical artery, it will be the vaginal artery. And also, there may be additional supply to the urinary bladder from obturator artery and middle rectal artery. It's venous drainage. In this picture, we have removed the left hip bone, urinary bladder, rectum to show clearly the veins behind them. The veins of the urinary bladder are formed from plexus of veins, called vesical venous plexus. These veins will gather together and drain into the internal iliac vein. Note that this plexus is continuous with prostatic plexus in males. That's why tumors could spread easily in this area, while in females, this plexus is continuous with the vaginal plexus. Its nerve supply. It has a parasympathetic innervation from S2, 3, 4 spinal segments. They are motor to the wall and inhibitory to the sphincter. They help in micturition. While its sympathetic innervation is from T10, 11, 12, and L1 and 2 segments, they are inhibitory to the wall and motor to the sphincter, and they help in filling of the bladder. Note that there are also sensory afferent fibers for recording distension of the bladder and pain sensation. It's lymphatic drainage. Most lymphatics drain into external iliac lymph nodes. Only few lymphatics end into internal and common iliac lymph nodes. After finishing the anatomy of urinary bladder, let's jump straight into its development and congenital anomalies. This picture shows an embryo after folding, and this yellow tube is the gut tube, which is, by the way, derived from endoderm. The upper part of the tube is called the foregut, and this middle part is called the midgut, and this lower part is the hindgut. We should know also this part, which is the cloaca. And by definition, the cloaca is the caudal expanded part of the hindgut. It lies caudal to the origin of allantois. The midgut has an intestinal loop which protrudes from it the vital line duct that moves through the umbilical cord. And this duct protrudes from the cloaca, moving also through the umbilical cord, called the allantois. Later, we will know its fate. What we want to know exactly from this slide is the cloaca, which is connected to the mesonephric ducts and the termination of the hindgut. So it's connected to two systems, the urinary and digestive systems. In this picture, we have shown only the lower part of the embryo, which shows the most lower part of the hindgut, the cloaca. What will happen to this cloaca? There is a septum called urorectal septum, starts to develop between the allantois and hindgut, here. This septum will divide the cloaca into anterior and posterior parts. The septum will continue to divide until reaching the perineal body. To divide the cloaca completely into two parts, the anterior part is called the primitive urogenital sinus. And this primitive urogenital sinus is closed by urogenital membrane. And it's connected to both mesonephric ducts and allantois. Let's move to the posterior part. which is called anorectal canal. It's called anorectal canal because it will give the future rectum and anal canal. It's the dorsal part of the cloaca after its division by the urorectal septum, and it's closed inferiorly by the anal membrane. The rest of the video we will discuss the urogenital sinus. This picture shows the urorectal septum after dividing the cloaca into anterior part, the urogenital sinus, and this dorsal part, the anorectal canal. The urogenital sinus is closed by the urogenital membrane, and the anorectal canal is closed by the anal membrane. Okay, what are the parts of the urogenital sinus? The cranial part is called the vesical portion. Its apex is connected to the allantois. By its name, it's clear that it will give most of the urinary bladder. Below the vesical portion is called the pelvic portion, which is a little bit narrow, and the lowermost part called phallic portion, or sometimes called the definitive urogenital sinus. It's the caudal flattened part, which is closed by the urogenital membrane. Later, this membrane opens to allow the passage of urine. Note that the mesonephric ducts that open into the urogenital sinus is placed between the vesical portion and pelvic portion. These mesonephric ducts will develop to form important male reproductive canals, the seminal vesicle and vas deferens. What is the fate of urogenital sinus? We have found that the vesical portion distended more, and that the pelvic and phallic portion give parts of urethra. Let's see what each part will give exactly. The vesical portion will give the epithelium of most of the urinary bladder, except the trigone. As the trigone is mesodermal in origin, not endodermal in origin. What else? It will give in males the pre-prostatic and upper half of prostatic urethra, while in females it will give the whole urethra, as it's shorter and only one port. The second part is the pelvic portion, which will give the lower half of prostatic urethra and membranous urethra in males, while the phallic portion will give most of the spongy urethra. The pelvic and phallic portions in females deals nothing with the urethra. They will give the vestibule and lower two-thirds of vagina. What is the fate of allantois? The allantois will constrict and forms the urachus, so that no urine will pass to umbilicus. And in adults, the urachus forms the median umbilical ligament, as we have discussed before. Let's summarize the sources of urinary bladder. Most of the urinary bladder, except the trigone, is formed from the vesical portion of primitive urogenital sinus, so it's endodermal in origin. How does the trigone is formed? I have two mesonephric ducts of mesonephris kidneys. The lower ends of these two mesonephric ducts, which is mesodermal in origin, will be absorbed at the back of the cloaca or the back of urinary bladder. So the other source of urinary bladder is mesodermal in origin, and this mesoderm results from the absorbed lower parts of both mesonephric ducts into the posterior wall of urogenital sinus to give the trigone, which is found in the posterior wall of urinary bladder. What are the anomalies of the urinary bladder? As we can see in this picture, this is the umbilicus of the baby attached to it the clamp of the umbilical cord. And this is the penis of the baby, and this is the scrotum. This part is the inside of urinary bladder. How does this anomaly could happen? So simply, there is no anterior abdominal wall in the pubic area and no anterior urinary bladder wall. So you can see the mucosa of the urinary bladder exposed at the surface of the baby. And there is no urethra, so it's called epispadias. This anomaly is called ectopia vesicae. It's by definition the absence of both anterior bladder wall and overlying anterior abdominal wall, as there is severe deficiency in the tissue forming the anterior abdominal wall, which is the splanchnic mesoderm. So the mucosa of posterior bladder wall is exposed with epispadias. The second anomaly is related to urachus. What is the urachus? It was the allantois, which is transformed into urachus connecting the urinary bladder to the umbilicus, and it should be closed to form the median umbilical ligament. What will happen if this urachus didn't close? This is the urinary bladder, and this is the urethra, and this is the urachus. It's still patent, making a connection between the bladder cavity and the umbilicus, making a possibility of passage of urine from the urinary bladder to the outer surface of the body. It has three varieties. The first one, urachal fistula. All the urachus is patent, allowing the passage of urine to outside from the umbilicus. Urachal cyst. Just a part of the urachus is still patent, and the other parts are fibrosed. Or urachal sinus. The distal part is patent, while proximally near to the urinary bladder, it's fibrosed. The third anomaly could be a problem in the urorectal septum that used to divide the cloaca completely into urogenital sinus anteriorly and anorectal canal posteriorly. This septum is not complete and left a small part which connect between urogenital sinus and anorectal canal, called rectovesical fistula, a connection between rectum and urinary bladder.